Tēnā koutou e te iwi wānui nau mai uki mai ki te wāpārikarika ki Te Whare Pūnanga Kōrero. Nei te tuku atu i te reo wakamihi ki a tātou nei kai kōrero ko uru mai ki roto i tēnei o ngā pāpāo. Nō reira, welcome back to Te Wāpārikarika to Te Whare Pūnanga Kōrero, and I have the privilege of speaking with my own iwi down in the south of Taranaki. And from Ngāti Ruanui, we have Graham Porter, and also from Ngā Ruahine we have Warren Nicholls. Nō reira, kōrua, tēnā kōrua.
Tēnā koe.
Tēnā koe.
Ka pai. Kia ora, kia ora. Can I start with you, Graham? I just want to say big mihi from Te Korimako o Taranaki to you all down in Ngāti Ruanui with all the wonderful work that you've been doing. And just, you know, tell us about what's been happening down there in the lockdown.
Well, we've been really busy during the lockdown. What we've been doing in the lockdown in particular is ramping up our vaccination clinics. So both our health centres, both in Patia and in Hawera, have been busy vaccinating and pushing through as many people as we can with a particular focus on our Māori and our descendants. So that's been really busy for us. We've worked 5 days a week, every week in lockdown, every week and every day in lockdown, getting those vaccines, getting those jabs in the arms, which have been so important for our people, and making sure we get the messaging out there as well to come in and get that vaccine. So, and at the same time, we've also been running our business as usual clinics in terms of our virtual consults with our doctors, and just making sure we're looking after those people that still need just everyday medical care and assistance with our community team. So a really busy time, and the staff have done a fantastic job being out there.
Oh, look, mihi to all the wānau there at the Ngāti Ruanui Health Care, and also to our iwi as well, Te Runanga o Ngāti Ruanui as well, and all the wonderful work that you've done. Listen, Warren, I want to come over to you. How's it been for Ngā Ruahine?
Yeah, it's been a busy time for us all, and I think you know, certainly for Ngā Ruahine, our focus has been on the other side of the COVID spectrum, ensuring that Māori have access to COVID testing. And so we've gone far and wide across the south central and coastal Taranaki to ensure Māori predominantly, but that those hapori had, you know, those communities had access to timely testing, and that no barriers to their access existed. And that was been really successful. Alongside of that, our vaccination coordinator role has been really hard at work behind the scenes, connecting with UDI to help facilitate booking them into COVID vaccination sites, such as Ngāti Ruanui, and liaising those appointments. The national booking system isn't easy for our people in many ways. So having a role like that is just another way of ensuring access is simple, and that they can be scheduled in a really timely manner.
Yeah, you talk about the vaccination bookings, and for many people it's quite hard, and they don't want to wait, and there's just a lot of barriers there for them to actually book their vaccine. But Graham, I want to come back to you now. In terms of the vaccine rollout for Ngāti Ruanui, are you doing the same thing? Are you going to be opening up the doors?
Yes, so we're actually, our doors are always open to anybody who wants to come in, and we don't turn anybody away. And I'd just like to reiterate what Warren has said about the booking system. It's very hard for our people to navigate, and it's very easy to be put off by it. So we actually running a campaign of ringing people directly. Both the iwi have rung, and the health centre are ringing people directly, because that's the best way to connect, and at the same time we can also alleviate any fears about the vaccine. But we're certainly got a focus over the last 2 weeks of open door policy, and in particular this coming Friday we have a full walk-in clinic at Ngāti Ruanui Health Care in Habura, where you can walk in. You don't need to have any booking, and you can have your jab. And we're also running a small incentive, $5 Kai voucher for Save. So there's a plug to come to Ngāti Ruanui Health Care on this Friday, and get your jab.
Ka pai, Graham. That's really wonderful news, and that's good for our people to know that they can go on. Now, there is still some worry, uncertainty around some of our Māori people about getting the vaccine. How do you handle that? How do you cope with that?
Yeah, I think, Graham highlight.
That's a concern because there's a concern. That's all right, Warren. There is a concern about there's a lot of misinformation in social media. And I think it's a really hard job to combat that. And that's why I think we have to use multiple ways of connecting with our people to ensure that we have the right information and can make an informed choice. They're still their right to make that choice, but I think it's really important that we get the information out there and having people who they trust, who they are prepared to sit and listen to, and not just maybe somebody, a face from the Ministry of Health telling you, but people they used to working with, used to getting healthcare from, and I think that's really important.
Ka pai, Graham. Warren, I'll come back to you. What are some of the comments that have been coming from our people that are coming in to get their vaccinations, or whether they've got uncertainty around that? What are some of the comments coming back from our people?
Largely, it is about just having really basic
I think some
communications.
Certain.
Sorry. Yeah, I think it's about really basic language, and people are being flooded with a lot of misinformation, as Graham has highlighted, and a lot of the messaging that is out through the national campaigns is in such a language that isn't designed necessarily to be fit for purpose for our udi. And so we spend a lot of time breaking that language down into really simple, meaningful language and live examples. And I think utilizing some of our own people as the champions, letting them tell their story of why it's important to them. And you will see just very recently starting a social media campaign around some of that simple messaging. It's also about actually being open to have the conversation and encouraging whānau to, if they are undecided, if they want more information, to actually come, have some whanaungatanga, have the conversation so that an informed choice can be made, as Graham highlighted. It's not about the end result in terms of what their final decision is. It's about basing that on accurate, clear, and understanding that information.
Ka pai. Now, I'm going to make sure that I go to the right person this time. And Graham, I want to come back to you. Before we talked about the Māori Only Vax rollout. Can you tell us about that?
About the vaccination rollout?
The Māori Vax. Is it Māori Vax roll? Is that the right title for it?
Sorry.
Oh, okay. We'll do that again. Shall we?
In terms of the... Sorry. Yeah, do that again.
Yeah, okay. All right. Just talking about the Māori vaccine rollout that's happening at the moment now that Hayden spoke about.
Oh, yes. Yes, so our specific focus is to make sure that there are no barriers to our people getting the vaccination. We've talked about how difficult it is for some people to navigate the booking system. So what we want to do is make sure information is out there for them to know where to go to, and that they know that that's as easy as possible. So fronting up to a vaccination centre, especially a Māori-led vaccination centre, is really important. People they know, they see every day, people they trust, and they know there won't be any bureaucracy or too much paperwork. We have a little work, but not too much to get in the way, and they can have their vaccine straight away. So it doesn't mean that that's delaying. It doesn't mean they have to go through a prolonged, consistent wait days. And they have to turn up. They can say, I'm going to have it today. I'm going to walk through, and there it's done. And that's a great way to do it, and that's a great way to encourage people forward to get. Also encourage, especially now in bubbles, we encourage people to come forward in their whānau bubble.
Ka pai. And my apologies too, by the way, Graham, it was Māori Only Vax Clinics.
Yep.
Ka pai, ka pai. Okay,
yes, and Māori Only Vax Clinics are really important because our people are lagging behind in such a way. We have to find ways of making sure we prioritise them going forward. They've got a huge equity gap between them and everybody else, and that's great for everybody else that they've come forward. But we now need to find ways to jab will come forward and give them a little bit of head start. So that's why Māori Only vaccination clinics are just so important to ensure that our people actually close that equity gap so that they're on the same level playing field as everybody else.
No reira, coming back to you, Warren, and within Ngā Ruahine rangi itself, taking a look at the stats, I mean, vaccinations, how many vaccinations have you done, the testing that you've done throughout this whole time?
So we haven't facilitated any COVID vaccination ourselves to date. We have been connecting people to existing vaccination centres such as Ngāti Ruanui, such as Tui Ora in Opanaki and their pop-up clinic. And so our big concentration has been on contacting Uri, having the conversation and then connecting them. And that's because our focus to date has been on the COVID testing. And we've done significant numbers of COVID testing around, like I said earlier, central, south and coastal Taranaki. And we will continue to do bubble testing throughout. We're now about to start the next phase of our response, and that is COVID vaccination clinics. They are Māori-led, they are Māori-focused, and our target is for our own uri first and foremost. They will be marae-based pop-up clinics. We've got a range of Ngā Ruahine marae that are going to be scheduled through the next 5 weeks, and then repeating that in later on in a couple of months' time for the second dose round as well. We've got a social media campaign about to kick off any moment, and we will certainly be sharing all that information with Te Korimako to also get that information out to our people. But no apologies, this is targeted for Māori. This is about reaching out, creating our safe space, creating the environment where those trusted relationships can reach out, support, have the conversations, and encourage whānau to protect our wakapapa, protect our mokopuna, our kaumātua, and, you know, whānau katoa.
Ka pai, ka pai. Coming back to you now, Graham, taking a look at the stats, what's the stats have been, what have the stats been like for the vaccine rollout down in Ngāti Ruanui?
So we've since we've been vaccinating, we've vaccinated probably about 1,500 Māori. So that's quite a significant number for the south. I think it's been really important that we have worked closely with the Taranaki DHB and making sure we've aligned how we've rolled out. We've mostly with Ruahine, in particular, as Warren said, they've taken a lead in some of the testing, taken a lead in some of the vaccinations. So we're working together to deliver a comprehensive push that as high as we can get that, because we know it's not about a sprint. It's not about getting everybody vaccinated in the next 2 weeks. It's about getting everybody vaccinated over the next 3 to 4 months. So it's a marathon we're running here, and it's going to be quite a long period of time, but we need to work moving around and running that marathon with us. And it's going to be a long haul. We're going to have to reach out and make sure we encourage people to get vaccinated, because that's the best way they're going to be protected.
Okay, all right. And now, of course, midnight tonight we'll be in level 2. What's that looking like for Ngāti Ruanui Health Care? Everybody's going to be busy again.
We're going to be carrying on. We're carrying on vaccinating. We're going to be bringing up some of our services that we have previously been shut down. We'll be bringing up things like Taranaki. We'll be bringing out our more mobile outreach services, and our community to be stepping out into our system at the moment. We're bringing all our services up as best we can, all within guidelines, all within the social distancing that is required now under level 2, or Delta level 2, as we should say. We still need to be cautious, but we will be bringing up more services as many people as we can.
Kia ora. Warren, coming back to you, for Ngā Ruahine, what does level 2 look like?
For us, that's the exciting part, to get back to having whānau engagement face-to-face. Obviously, level 2, we've got some heightened restrictions upon us in terms of how we keep ourselves safe. So there won't be too much program and activity spaces where we bring groups together, but, you know, getting right back into supporting whānau in a face-to-face manner. The whole team's excited to get back to that space. I think whānau in general have been a lot more resilient this time round, and you know, we haven't quite had the duration we've had to have in past lockdowns. So we want to get right back in there and support whānau to get back onto their solid foundations and keep moving forward in their waiora, in their well-being, and how they prioritise their needs moving forward. The business as usual will always be there, but we don't want to take our pedal off our COVID response as well. And it's really important we try and continue to commit to both areas. And it does take a toll for both our services. And, you know, we are trying to juggle several balls in the air, but, you know, we have to be there for our whānau.
Now, coming back to you, Graham, because we're coming down to the end of our kōrero, but I'm going to leave the last words for you to, you know, whether you want to do a mihi or whatever it is that you want to say, because we are going back into level 2, and I will leave this time for you. Kei a koe.
Oh, look, it's what my message to everybody and the listeners out there is really to, if you've got any concerns, look, give us a call. We can come out and see you, even if it's at a safe distance, the right information decision. It's my message. We're here to you offer the possible service for vaccination to you. Concerns, but the priority is to try and get you vaccinated. It's your best team.
Ka pai. To you, Warren, last words. Kei a koe te wā.
I suppose just to tautoko Graham's comments, the vaccination is your best protection. This nārara is not going away anytime soon. And, you know, in fact, it's the other way around. We're seeing a new variant. We're exposed to higher risk. And the only way to protect one another, not just ourselves, is to increase our vaccination and be fully vaccinated. And, you know, if there's anxiety, if there's concern, questions, likewise, we want to know about it. We want to have the conversation. But also, you know, it's about how we continue in our normal lives, and there might be just general conversations that whānau need to have about how they continue to keep themselves safe, and that's at the forefront of all our minds.
Ka pai. Ka pai. Look, there was one question that I was talking to you guys about, and any responses to David Seymour's comments that he made on Twitter?
I think, you know, it speaks for itself. And we should, you know, in the words of our Waine Debbie, we shouldn't be unapologetic in our approach, in our task of serving our people. And to have that undermined in the manner in which it was, to have that raised in the way it was, just, I suppose, speaks for itself. So now's the time not for those politics to be played. Māori should be encouraged as a treaty partner to have their own ability to serve in their approach in a mana enhancing way, without any restrictions, without any barriers, and in a methodology that's fit for purpose for Māori by Māori.
Tēnā koe. Graham, have you got a comment on David Seymour's Twitter? I think we may have lost Graham in transition, but nō reira kia kōrua. You back, are you, Graham? We'll carry on. Nō reira, ngā mihi kia kōrua me o kōrua kōrero, hei hāpai I te ora o te tangata, hei hāpai I te ora o te iwi. Nō ringi I tērā kia koe Warren, nō Ngā Ruahine Health Services, mihi atu kia koe. Kia koe, Graham, it's been wonderful having Ngāti Ruanui on board. And mihi to you and your crew, your whānau at Ngāti Ruanui Health Care. Kia koutou rā e mātakitaki mai ana, e wakarongo mai ana kia mātou. Koia tērā, engari te mihi atu kia tātou nei rātonga haura. Koia tēnā. Nō reira, with that, I just want to thank both of you for coming on board with us, and after we finish, we'll just stay with me, and we'll come back later on. And nō reira, tēnā koutou, a tēnā no tātou katoa.